terms of prostate cancer screening, the current recommendation by the U.S. Preventive Task Force is that men between the age of 55 to 69 have a discussion with their physician about whether or not they should be screened. Okay. Now, the U.S. Preventive Task Force based this decision on studies, as I mentioned earlier, in predominantly white men. If you look at American Cancer Society, the recommendation is that African American men are screened at age 45, and African American men who are 40 but have family history of prostate cancer should be screened at age 40. So the issue is most physicians follow the US Preventive Task Force recommendation for white men. And so if you have family history, or if you're just 45 and you want to know, do you have prostate cancer, you have the right to ask your physician and let them know. Show them on your phone. American Cancer Society recommends this for me, because of my race, because of my family history, and your insurance will cover that. Now, these recommendations for Black men in their 40s is not just for no reason. It's because we see prostate cancer in men at this age. Like I said before, my dad being diagnosed at 50 with a PSA score of 64 means that he was growing prostate cancer in his 40s. And who knows how early in his 40s that was happening. At City of Hope, we provide free prostate cancer screening in the community. And, there's thousands of men that are eligible to be screened. And what we see is there are men in their 40s that have elevated PSA. And if we can catch that early enough, that's a game changer for them in terms of the length of their life and the quality of their life that they'll have moving forward. So one thing that we see in the community, and I talk to a lot of men about, is men, not even just men, people in general trust their doctor, right? So they trust to speak to their physician. And if the physician says it's your annual visit, you need to have A, B, and C done. A lot of men, they'll say, oh, I went to the doctor, I had everything done. And we really have to let them know your doctor may not have included that with everything else. Yes, you got your blood pressure checked and your blood sugar, and they checked your weight and all this, but go through your record. And a lot of these records are electronically available on apps now, and just look at your app and see, did they test for PSA? And if they didn't, and you're 45 and you're African American, or you're 40 and you have family members, then that's something you can shoot your doctor an email and request and just say, I'm concerned about this, and I would really like to have this test done based on American Cancer Society's recommendations. And what we see a lot of times too in the community is men will say, well, I feel fine. What you need to understand about prostate cancer is men do not have symptoms, unfortunately, until it is beyond early stages, is how it works. And so as men get older, their prostates enlarge, whether or not they have prostate cancer or not. And it causes a frequency in urination, especially at nighttime. So if you have frequency in urination that will occur as you get older, that's something you need to let your doctor know. It may not be prostate cancer, so don't freak out, but it very well may be. Other symptoms as prostate cancer progresses include back pain, sometimes sexual dysfunction, things like that start to occur. And, back pain could be anything. So that's why it's important to get your PSA tested, even if you don't have symptoms, because I can tell you what, my dad did not have any symptoms with a PSA of 64. And the only reason he found out was on accident. In an emergency room, he went to the ER after having a colonoscopy, and my dad never got sick for anything. He didn't even understand what physical discomfort means. And he had a colonoscopy, and if you get a colonoscopy, they tell you afterwards, you may have some gas pain. He had never had gas pain. So he didn't know when he was hurting so bad afterwards, he just thought, this is not okay. This is not okay. He goes to the emergency room. They say, listen, sir, it's just gas from your colonoscopy. But by the way, we ran your blood work. Your PSA is extremely elevated. He found out on accident. Who knows how much longer that would have been growing after that. And so I say all that to say, do not wait for symptoms to come, and that Black men do get prostate cancer young, and that you want to catch it early, because then you have 100% cure rate when you catch it early. So it just makes the most sense to stay on top of it.